Next is about the lekhya roga pratishevam व्याख्यास्यामः यथोवाचपुरानन्दमन्त्रिः नमये अभीताः लेख्याः सामान्याः तेषु अयं विधिः स्निग्धवान्तवेक्तस्य निवात आतपसद्मनि आप्तैः दृढं गृहीतस्य वेश्मनि उत्तानशायिनः सुखोदकप्रतप्तेन वाससा स्तूनायितः स्वेदयेत् वर्त्मनिर्भुज्य वामाङ्गुष्ठाङ्गुलिस्थितम् अंगुली अंगुष्ठकाभ्यां तु निर्भुग्नं वर्त्मयत्नतः प्लोत अंतराभ्यां न यथा चलति संसतेऽपि वा ततः प्रमृज्य प्लोतेन वर्त्मशस्त्रपदाङ्कितं लिखेत् शस्त्रेण प्रत्येवा ततो रक्ते स्थिते पुनः स्विन्नं मनोह्वा कासीस व्योष आर्द्राञ्जनसैन्धवैः श्लक्ष्णपिष्टैः समाक्षिकैः प्रतिसार्य उष्णवारिणां प्रक्षाल्य हविषा सिक्तं व्रणमद् समुपाचरेत् स्वेद अवपीर प्रवृत्तिं स्तेहात् ऊर्ध्वं प्रयोजयेत् व्यासतस्ते समुदिष्टं विधानं लेख्यकर्मणि. Now lekhana or curating of the eye, this palpebral is the procedure. Now very important is Sushruta has suggested that lekhana karma, curating as the treatment in 9 of the diseases, and majority of them are the diseases of the palpebral, which are presented as either localized swellings or maybe at times it could be the rough proliferative swellings over the area. The procedure, common technique of the curating is the patient has to be given snehana, vaman and virechana before the treatment, and the patient should be kept in a controlled ventilated room, operating room. Nivada atapasadmani is where there is no free movement and the environment is controlled. And as usual in all other conditions, the patient has to be positioned properly and held by the assistants in a prone position. And before you start with, the whole eye area, the orbital area, has to be warmed with a cloth which is dipped in warm water, and a svedana also has to be done. And then the vartma or the palpebrae had to be kept open and immobilized with the anguli and angusta, with the thumb and the other finger of the assistant, and it should be you have to keep it in a firm position and do not allow it to move, and it has to be held with a cloth, clothantarabhyam. It should not move and it should not be again get closed also. Then the whole area of that palpebra has to be cleaned with another cloth, and it has to be curated either with the instrument, curating instrument, or with a leaf, rough leaf, as in the Rekhana Shastra Karma. It has to be curated till the lesions are removed and established the hemostasis. You have to ensure that the bleeding has stopped at the area. Then after that, kasisa, vyosha, ardhanjana, etc., they have to be applied and then washed out with the warm water, and then apply ghee over the area and treat it as any other wound. If there is a need for svedana or avavidana, it should be done only after 3 days after the initial procedure, and this is a general procedure for all lekhya vyadhis. Raktam akshishravet skannam kshatat shastrakratar dhruvam raga shopha parisrava timiram vyabhya nirjayaha vartna shavam gurustabdham kandu harshopadehavat netrapakam mudirnam va kurvita pratikarinah etad durlikhitam jnayam snehitva punah likhet. Complications which can occur could be either there could be bleeding, and that blood which has become leaked out may become clotted, and that clot that again may produce local hyperemia, swelling, or even discharges, or even loss of vision also can occur, or it also can result in shavavartma, that's edema in the whole palpebral area, or there could be the itching and maybe the irregular sensation over the area, or even netrapaka, that's the endophthalmitis also can be a complication, and these complications have to be avoided. If such complications do occur, they need to be treated properly, and again if there is a need, you may curate again as such. व्यावर्तते यदावर्तना पक्ष्मचापि विंशति स्यात् सरुक् स्रावबहुलं तदति श्रावितं विदुः स्नेहस्वेगादिरिष्टः स्यात् क्रमः पुत्रानिलापः. An excess of curating or a complications of overdoing the procedure could be like the palpebrae, they may become retraction of the palpebrae, and or even there could be excess of discharges from the area, or the pain also could be the signs of atistrava or ati lekhana, and in such conditions sneha, svega, these have to be given and all vatakna procedure has to be done. Samam likhet medhavi shava kardama vartmani. In the shava vartma and kardama vartma, there are varieties variations. The treatment has to be curated with a uniform manner. Ultimately it has to be to ensure that the surface of the palpebrae are uniform. Now, in the conditions of kumbhikini, sharkaram, tasaiva, utsangini, mavi karpetva, shastrena, likhet, paschadadanditaha. In the kumbhikini, sharkara, all different types of chalazion, or sharkara where there is a calcified lesions, utsangini, the style asset. In these conditions, they have to be located properly and curated with a specific instrument. Leaf cannot be used there. Then bhave vasmasya pidaka katina prasham hruswaha tamrashchapakvaha bhedya bhinnaha likerapi. Now vatma pidakaha, trachoma-like lesions, where there could be a granulomatous lesion. In such conditions, it may be difficult to curate it out because they are small and reddish in color. In such conditions, you wait till it becomes separated, and after it becomes separated, it has to be curated out. That's the procedure suggested by Sushruta. Of course, in the present day situation, we may not follow exactly the same procedures as such. Then tarunishcha alpasamrambhaha pidakaha bhahyavatmajaha viditva etaprashamyeta sveda aleparashodhinehi. Eruptions, polyp-like eruptions over the outer surface of the palpebrae, they may be managed with the sveda alepana shodhana. A curating may be avoided in such conditions. Curating as a procedure in ophthalmology is still practiced mainly in localized lesions like chalazion or maybe any other papillae or even the calcified lesions over the palpebrae. For curating, we now use a specific curating instrument, and the procedure, of course, is now it is achieved with local anesthesia. And then for holding the palpebrae in position, we use the retractors. Now, the difference between what Sushruta has done and now is Sushruta had used made use of an assistant to hold the palpebrae in position. Anesthesia was not there. Now you use the local anesthetic, and then the procedure positioning is done with the retractor, which makes it convenient, and then the curating is done. The only difference is about the indications. Conditions like trachoma are not now treated with the curating because they can produce more harm, whereas localized granulomatous lesions are treated with the curating now. That's about the lekhya roga pratishedadhyaya. If Sushruta Samhitayam Uttaratantrantagate Shalakyatantre lekhya roga pratishedadhyayam pratishoda nama trayodashodhyayaha. We'll continue into the next chapter. The अथातो भेद्य रोग प्रतिषेधम व्याख्यास्यामः यथोवाच भगवन्तनत्परिः स्वेदयित्वा विसग्रन्थिं छिद्राणि अस्य निराशयं पक्वं भित्त्वा तु शस्त्रेण सैन्धवेन अवचूर्णेत काशीस मागधी पुष्प नेपाली एलायुतेन वा ततः क्षौद्रगतं दत्त्वा सम्यक् बन्धम् अथाचरेत्. In case of the bisagranthi which you have considered as Marfan syndrome, in the where there is a lymphedema and then there will be multiple opening. Sushruta has considered that the bisagranthi in the asadhyavyadi list. That's also a very interesting issue. But at the same time, the procedure suggested by Sushruta is a bhedya, where because there are multiple openings, they have to be drained out completely, and then apply Saindhachurna or Kasisa, Magadha, etc. Apply, and Shaudra also has to be applied, and a bandage has to be done. In the present day situation, in Marfan syndrome, we may not opt for a drainage. Instead, antibiotics and corticosteroids are the usual prescriptions. Our usual treatment like trifluopyr gandhakasayana given for a long period also can help in reducing the edema and the discharges as such. So, may not be the bhedana as such is practiced. Then, in case of lagana, that's lagana is cysts of the present diagnosis, like cysts of G's, where you may see this waxy material collected and then a typical cyst with a thin border in the eyebrow. In such conditions, Sushruta has suggested रोचना क्षारवृत्तानि पिप्पलक्षौद्रमेव च प्रतिसारणम् एकैकं भिन्ने लगणिष्यते महत्यपि च निर्गीता क्षाराग्निः विधिकोविदः. Initially for this lagana you have to apply gorochana, kshara, tuttha, etc. And because of the pratisarana it becomes open, it gets drained out and then it's this washed up as such. So bhedana with the application of pratisarana kshara is suggested there, and then whatever is left over can be cauterized as such. This is what Sushruta has suggested. In the present situation, for the cysts-like conditions, the opted treatment is excision. Excision is a relatively simple procedure with the current protocol and usually doesn't lead to any major complications. Then, Svinna Bhinna Vinishpitya Vishaganjananamikam Shila Yela Nasa Sindhuttaihi Sakshodrihi Pratisarayat Rasanjana Madhubhyama Bhitva Va Shastrakarma Pratisarya Anjane Injata Ushnehi Deepashikhodbhavehi. Now, Sushruta has suggested the treatment for Anjananamika with the Bhedana. Anjananamika, we have considered this as blepharitis. Again, blepharitis could be of two types, anterior and posterior. In the anterior blepharitis, maybe this kind of a treatment may be possible. Where Sushruta suggests Shila application of Pratisarana and Rasanjana and then Bhedana is done. But in the present day situation, most of the times blepharitis is managed with simple medical treatment like antibiotics as well as local application of non-steroidal anti-inflammatory drugs or maybe occasionally steroids can be the management. And most of these conditions there will be an underlying systemic pathology like seborrheic dermatitis or ocular rheumatoid pathology, etc. And their treatment is the primary treatment there. And occasionally it may present with the acute exacerbations, and during that condition local steroids could be the option of the treatment. Those who have suggested Bhedana. That's in case of the anterior blepharitis. In the posterior blepharitis, some extremely krimi grantha, Sushruta has considered this as krimi granthi, bhinnasya pratisaranam triphala tuttakasis in the Vaishya Kriya. Posterior blepharitis is a variant where you will have the inflammation on the posterior segment, which can be quite more complicated, can produce more severe clinical symptoms. And in such conditions, Sushruta has suggested application of pratisarana and rasakriya also has to be done after the svedana. With that, it may have a spontaneous rupture. Of course, in the present situation, we usually prefer to use the current protocol of the treatment like local, same as earlier, drops and then the antibiotics also could be the option of the treatment. Rarely you may require a surgery in such conditions as such. Then Bhitva Upanaham tu Kapajam Pipadi Madhusaindavehi Lekhya Mandalagrena Samantat Pratyedave. Now Upanaha, the lacrimal cyst conditions, Sushruta has suggested the treatment with the Pipadi Madhu Saindava application and then Lekhana Shastrakarma. Though it is mentioned in the bhedya vyadi, the suggested treatment is lekhya shastrakarma, and prachana has to be done. Raktamokshanam can also be done. In the present day situation, lacrimal cyst, the usual treatment and a convenient treatment will be excision. Simple excision is the optimal treatment in case of lacrimal cyst. Then, samsneha patrabhangescha svedayitva yathaskam apakat vidhinoktena पद्म मेद्यान पंचभेद्यान उपाचरेत सर्वेषु एतेषु विहितं विधानं स्नेहपूर्वकं संपक्वे प्रयते भूत्वा कुर्वीत व्रणरोपण. Mean all the 5 major diseases which are categorized as bhedya vyadi, the protocol is snehana has to be done, and svedana with patrabhanga, leaves, heated leaves are applied. And as usual, all apaka vijana, the paka vidhi has to be followed. So the separative protocols which are mentioned in the Shashtiropakrama have to be followed. And in all the conditions, snehana is the initial treatment, and once it becomes separated, it has to be drained out, and the Pranaropana Chikitsa has to be followed. With this, we conclude the bhedya roga pratishaya. So 2 chapters completed today. Then of course, we will, if there are any, I think we will conclude. If there are any questions, then we will conclude today. Bit early, 2 chapters completed. Right, there are no questions, so we will conclude today. In the next chapter, next session, we will have the further conditions. Right, okay, bit early, but still